We're back at the Ferezy Clinic in Windsor Heights today to talk to Dr. Joe about a problem that plagues a lot of us, backaches. So Dr. Joe, how do you fix back and neck pain?
Well, you know, Kathy, as we said in other shows, there are a lot of tools that we have, manipulation and ultrasound. Today I want to talk about something that's called decompressive traction.
And what is that?
Decompressive traction is a form of traction. Now, old-fashioned traction, what would happen, and by the way, it's about 4,000 years old. Hippocrates wrote 2 books on, one called Articulations, and he had various kinds of traction in there. But normal traction, you're just going to go ahead, let's say we have 100 pounds of traction, which would be a lot, but let's say we have 100 pounds. You're going to go ahead, do the traction, it's going to hold for however long, let's say 15 minutes, and then it's going to stop. So anything pulling you apart is traction. Decompressive traction is a little different because while we might go to that 100 pounds for a minute, we then have the machine or the computer drop you down to, let's say, 50 pounds for 30 seconds, then back up to 100 pounds for a minute, and then back down. So it's sort of an alternating type, but it never goes all the way down to 0. And what they found is this is a very effective sort of traction.
So what kind of conditions does this treat?
It treats a wide variety of conditions. In fact, it treats the ones that are responsible for the most common kinds of back pain. That would be facet syndrome, which chiropractors call subluxation, but also degenerative discs, herniated discs, both a single herniated disc and multiple herniated discs. And so these are the conditions that most people have. In fact, there was a study done at the University of Chicago, Illinois, in the Department of Bioengineering. And in that particular study, what they found, and they tested all these things, they had almost 800 cases from 22 different medical centers. I'm going to read you what they call the outcome, meaning that this is what they measured. When patients came in, they measured their pain, they measured their mobility, and they measured their activities of daily living. They then went through a regimen of decompressive therapy, and about 71% of the 778 cases were considered successful. And the consideration of successful means that at the end of therapy they were either at a 0 or a 1 on their pain scale.
So the patients had little to no pain?
That's right. At the end of the study, at 0 would be no pain. And I'm going to put some slides up here. In the first one you'll see facet syndrome, and you can see the precipitous drop in the pain level. And it really doesn't matter if we talk about facet syndrome or single disc herniation or multiple herniated disc. You can see on the left side of the slide where there's no pain and then worst possible pain, and you can see how the patient's pain just dropped precipitously. Also for extruded herniated discs and for degenerative discs, pretty much all the same. The treatment was very, very successful.
So are those the only conditions that it works for?
Actually, we found that besides the ones that are in that study, that spinal scoliosis, spinal stenosis, and a condition called spondylolisthesis also respond very well to the decompressive traction.
And what are those things?
I'm going to go ahead and show you what the decompression is like, but let me just say that if you have one of those things, some doctors told you and you know it. So if you don't know what that is, then you probably don't have those right now. If you do, then we'll figure it out and explain it to you. All right, so the first thing we'll do, Kathy, is have you put this belt on. So go ahead and stand up in front of me here. Okay. I'm going to put it on. Just go ahead in the front and touch that Velcro. Perfect, okay? I'm going to have you lay down on your back and put your head right up here on the top of this blue thing. Next thing we're going to do then is put the thoracic harness across your chest here, like that. Okay, and then your arms down. Then I'm going to go ahead and put this pelvic buckle on, and we're going to tighten that up sufficiently. And we're going to take this little buckle, and we're going to hook it right here on this buckle. Then we're going to put these little cushions under your knees, because it's always better when you're lying on your back to keep your knees bent. It takes a little pressure off the back. Now, just in case at any point it was uncomfortable, we always give the patient a switch, and anytime they hit this switch, it just shuts the machine off completely. So you're in control of that.
Okay.
Now, next we go over here to the control unit and we set it. Now, if I set it at a low traction, you may not even feel it at all. If I set it at a medium level, then usually what happens is people feel it's very comfortable. If I set it too high, then you start telling me military secrets. And then we just go ahead and start the machine. Now, we can also do decompressive traction on the neck. The thing works exactly the same, but as you can see, we've got you set up here where the machine will just be pulling straight up on your neck. And really it makes sense, right? Gravity all day long is just pushing your spine, crushing it together, and traction just the opposite. It gives the spine a position of decompression. So decompressive traction, as I said, works on a wide variety of conditions. It should be very comfortable, and it's really a great therapeutic tool for us.
If you'd like to visit the Ferezy Clinic, you can stop by their office in Windsor Heights, call them, or find them on the web at ferezyclinic.com.